According to the National Institute for Occupational Safety and Health, about 2,000 U.S. workers sustain job-related eye injuries that require medical treatment. Safety experts report that the right eye protection can lessen the chances and severity of injuries by 90%. The Healthy People 2020 goal is to reduce the quantity and severity of eye injuries in the workplace. And this is an example of a hazard when working without eye protection.
Ow! That hit me in the eye.
This worker was not using the proper safety equipment, which led to the serious eye injury. There are two instances where eye protection is needed in the workplace. One is projectiles, which include dust, concrete, metal, wood, and other particles that can get into your eye at any moment. The second is radiation, which includes visible light, ultraviolet radiation, heat or infrared radiation, and lasers are another form of injury to your eyes. Some working conditions include multiple eye hazards. The proper eye protection takes care of all hazards. Occupations with a high risk for eye injuries include construction, manufacturing, mining, carpentry, auto repair, electrical work, plumbing, welding, and maintenance. This is the correct way to wear protective eyewear while working.
Glad I had my safety glasses.
This is an example of a hazard when working without eye protection.
I should have worn my goggles.
Dealing with chemicals and bloodborne pathogens should look like.
Good thing I have my goggles on.
The Occupational Safety and Health Administration, commonly known as OSHA, requires every employer to ensure the safety of all employees in the work environment. According to the American Nurse Today Journal, eye safety is important in nursing because of the close contact with blood and bodily fluids that nurses are subjected to on a daily basis. Pathogens can enter the body by making contact with mucous membranes, which could then spread to other patients, staff, and family members. Not only is eye safety important in preventing injury, but also in preventing the spread of infection.
Overall, wearing eye protection can significantly decrease the chances of getting eye injuries in the workplace. Should an injury or incident occur, there are several things that can be done in the case of an emergency. In the case of chemicals in the eye, one should flush and rinse the eye for a minimum of 15 minutes. Contact lenses should be removed and bandaging is not necessary. If particles are in the eye, try not to rub it, and tears or eye drops can be used to remove it without touching the eye. For blows to the eye, apply cold pressure. In the case of punctures to the eye, do not attempt to remove any item that may have caused the penetration and do not rinse it. In all cases of emergency, if the situation becomes severe, make sure to call EMS immediately. Protective eyewear can lower these risks, but accidents do occur, so it is always important to respond to these situations accordingly.